Hi, I'm Julie Lubinsky, Web Manager for the Christopher and Dana Reeve Foundation, and I'd like to welcome you all to this month's edition of Ask Nurse Linda. I want to tell you a little bit about Linda. She's been a leader and a provider of rehabilitation nursing for over 30 years, and she's a very good friend of the Christopher and Dana Reeve Foundation. Soon after Christopher was paralyzed, she began working closely with him on his recovery, and it was a special time for her. She had the opportunity to watch him evolve into a uniquely gifted advocate for people living with paralysis, and she is now also our Ask Nurse Linda in our online community, and she answers questions in our community every Wednesday evening from 8 to 9, and once a month she joins us here in a live chat. So I'd like to welcome you all, and I'm going to turn it over to Linda to get us started. Hi, Linda.
Hi, and thank you, and good afternoon, everybody. I'm so happy that you're here today. Such a lovely day, and I hope nobody's being affected by some of the bad weather I hear that's out and about. But anyway, this month the topic on the blog has been general health maintenance, in particular to people who have spinal cord injury. And it can be spinal cord injury from trauma, or it can be spinal cord injury from medical causes. I know I've spoken with some of our listeners and readers of the blog, and sometimes people who have spinal cord injury from medical problems feel like they're kind of left out group. So I hope that when you read the blogs this week, there was special attention made to the differences in individuals who have spinal cord injury from trauma, which happens just all of a sudden at an accident one day, and boom, you're confronted with all of this. It's quite a different experience for people who have spinal cord injury from trauma, and there are a lot of people that are in that situation too, where their progression of their disease is rather slow. Sometimes it doesn't progress at all, which is wonderful, but sometimes making some of those decisions are very difficult. Should I still be driving the car? Should I stop driving the car? Should I still be walking around in the community, or is it becoming such a problem and exertion that maybe it's time to switch over into a wheelchair? So it's really kind of a whole different set of issues. But this month we focused on health maintenance, either for people who have traumatic injury or who have an injury through disease. And it can be any kind of paralysis. And I started out by thinking about this topic in general in the fact that there's so much going on in research right now. Just this month there was a release of a videotape of an experiment done on one person, so not a large experiment, but an experiment that was done with one person where some equipment was placed actually inside this person's head, and they were able to think things and then control and have actions and be able to do functional things just by thinking about it through this implanted device. Very forward-thinking, very much out there, very, very specific and individual to that one person. Sometimes when there's experiments that are done, research that's conducted with just one person, people think, well, that's neat, and that worked for that one person who had a lot of resources. And I hear all the comments about this one experiment that was done, and I think, well, these are all the things that was said in the Christopher Reeve Recovery Project. Here you have a person who has a lot of resources. People think that because somebody is in the entertainment industry that they must have a vast amount of unlimited resources and access to things that other people don't have. And I suppose to a certain extent, having that notoriety does open doors for you. There's no question about that. But it's still up to the individual to be determined enough to carry through with some of those therapies. So thinking about the research that's going on now, which is very exciting, how will that play out to the general community? We have no idea yet. It's still rather new. But you just never know with research what's going to really click in, what's going to be easy, what's going to work. The Christopher and Dana Reeve Paralysis Foundation have funded and are sponsoring in part this the big idea. If you read the Paralysis Foundation website, you've read about the big idea. That certainly is work that had come out of that first Christopher Reeve project, that N of 1. Now, the Christopher Reeve project happened many years ago, and now we're advancing with the big idea, and here's another person with a different idea of this implant in the brain. So there's lots and lots of things going on, and this is what got me thinking about general health maintenance, is that you have to be able to maintain your body in a healthy state to be able to participate in the treatments that will be coming up in the future. So that's what got me with the idea about looking at general health care. So thinking about things like caring for your mouth. We all know, well, gee, we should brush our teeth after we eat, et cetera, et cetera. But more and more information is being released about having a clean mouth and what a difference that makes in our whole digestive tract. If you have respiratory problems or swallowing problems and you swallow clean fluid from your mouth as opposed to having food or bacteria in your mouth, you have a lot less chance of developing pneumonia and other complications. So very important piece of maintaining your health for everyone. Good health care is related to good cardiac care, to good bowel function, to good stomach function. So our mouth is kind of that gateway for bacteria, another place for bacteria to enter our bodies. And then looking at nutrition and maintaining a healthy diet, keeping the body healthy and functioning, supplying the nutrients that the body really needs to function well. And then exercise, keeping our body in shape, keeping the joints limber, keeping the muscles engaged in some way. So if you think about it, if tonight something would happen, tomorrow we would wake up and there would be a cure for spinal cord injury, which would be so fantastic. But then we also have to think, if you're a person with a spinal cord, be able to then function again in the same way as it did before once you had that. So it all fits together. So it's, on the one hand, the research is exciting. We all like for it to progress. We want it to continue to progress. We're very hopeful about things that are going on, but you can't really let that be your whole consumption of your life, that just one day there's going to be a miracle overnight. That would sure be swell. But it's probably going to be a combination of several therapies, including movement therapy, maybe medication, maybe an implant, maybe some sort of surgery. The actual key to this is probably not just going to be one kind of thing and then it'll be better. It'll probably be a combination of therapies, or at least that's the way we're thinking about the whole thing now. So there's some questions in, so let's go ahead and look at some of those. And Tricia is asking if it's first time to exercise after the accident and after getting the okay from the health professional. Is it okay to exercise on my own, or should I consult a trainer? Well, what a wonderful question that is. And I love the fact that she put in there, after getting the okay from my health professional. Because when you start an exercise program, if you have a spinal cord injury, or if you don't, if you're just the average Joe walking around on the street and you decide, I'm going to get really into exercise, you don't want to just jump right into it with full force, because your body's just not ready for that kind of stress, and you don't know what's going on in your body, especially after a spinal cord injury. Blood clots in the leg or in the arms, blood clots can occur in the arms also. They can be present, and when you start to exercise, doing that kind of activity is you could loosen that blood clot, creating a real life-threatening situation for you. So you want to go to your health professional and you want to get checked out to make sure that your body's in good functioning form. You want to make sure that your cardiovascular system is such that you can start that. There is something that we call in healthcare, and probably a lot of you have heard it, it's called deconditioning. A lot of times people are sent after any kind of major surgery or any kind of major health crisis. A lot of times people are sent to the rehabilitation center because they have this phenomenon called deconditioning, where your body's just been laying in bed for a while because, of course, you've been very sick. Maybe you've had major surgery. You're having some kind of recovery process. Even if you're a person that just got the flu and you were in bed for a couple of days, we know that when you get up, your muscles are a little bit weak because when they're not used, they become a little bit more weak. And we know that the body is used to then laying flat. It's difficult to get in the upright position. Sometimes you can get what we call orthostatic hypotension, which is blood pressure drop when you elevate your head. So it's hard for the heart to adjust. When you sit up, your heart has to adjust its pumping so that blood gets pumped up to your brain, because otherwise it tends to pool down in your legs. So when you sit up, sometimes people get this OA, or orthostatic hypotension. So just checking with your health professional, making sure that everything is as it should be so that you can start, and then start out very slowly with what you choose to do. You can choose to use a trainer, or you can go to a physical therapist who can set you on a path for exercise, or you can even start on your own. And the very first thing to do is, for any body part that you can move on its own, do active range of motion. So move your body part, your limb, through every single way that that joint moves naturally. If you have spasms, you might want to put a little resistance on there, but you want to be careful that you don't damage any muscles that are resisting you. If you have contractures, you don't want to push past that and snap a bone, because if there's actually a contracture there, the joint's not going to extend fully. So check with your healthcare professional, see what your limitations are. Start out with active range of motion, moving what you can. If you can't move a body part, if your arms are mobile, you can use your arms to move your legs and your feet, to move them through the range. When you're moving a body part or having somebody else move the body part, then we call it passive range of motion. But this is still a good exercise to get started, so you can ensure that your muscles are still being engaged. Now, if you have paralysis and you're moving a body part that's affected, you would be doing the passive range of motion, but the muscle's still getting movement to the muscle. It's not getting movement through connection to your brain, because that's not able to get through at that particular moment. But you still are giving that muscle some input, some feedback that it's moving, and the muscle will still be exercised in that way. Another thing that you might want to try doing, and you'll need to talk to your healthcare professional about this, but is to try to get a standing frame. Now, a lot of us don't think of standing as an exercise, but after paralysis, it becomes an exercise. So a standing frame is a piece of medical equipment where your joints are blocked, so that even though you cannot stand on your own, in the standing frame you'll be able to stand. This allows the engagement of the body and allows weight to be put through your bones and through your muscles of the part of your body that is not getting that message from your brain. So you'll be able to increase your bone mineral density. It's a good exercise to put weight through those long bones, so your body gets that input into standing on your body. You can get standing frames that have a reciprocal movement. So if you can move your arms, that the device will then move your legs as your arms move. Most insurance payers will pay for these. Now, you still have to get, usually it's not in your plan. You have to have your health provider write a letter of medical necessity, is what it's called. They have to write it and explain to your provider why you need this particular piece of equipment. Now, they'll write the letter, and the response will come to the owner of the policy. So the response will not go back to your health care provider. It will come to you if you're the owner of your policy, or if you're on your spouse or your parents' insurance policy, the response from the insurance company will go to them. So everybody involved has to be aware and alert that these things are going to happen, because the owner of the insurance policy is the only person, the healthcare payer, the person, the insurance company, if it's Medicaid or Medicare or a private company, they're the only ones that the insurance company will communicate with, is the owner of the policy. However, your healthcare provider is the one who needs to write the letter, because they know the ins and outs of your medical condition. They speak the medical jargon that the insurance provider understands. So everybody has to be aware, because the first letter that comes back to the owner of the policy more than likely will be a rejection. We will not provide this person with a standing frame. It's not a part of the policy. Generally, then an appeal has to be made. So then it goes to a higher level, and that's where really the device is reviewed for applicability. And there's so many benefits to a standing frame that very few payers will refuse the standing frame these days. However, they are out there. So if you do get a final refusal and they won't allow a standing frame, you can ask different organizations perhaps to fund one for you, have fundraisers, but pretty much most everybody allows us a basic standing frame nowadays. So that's another good way to get started. Now, if you go to your local gym, there might be people there that are trained to work with individuals who have some sort of paralysis that will be able to help direct you in your exercise program. Or there may not be somebody who's keenly aware of the issues for individuals with spinal cord injury. You need to be, to talk to somebody, find out what their qualifications are as their trainer, and see if they really know what to do. You will know what to do. For instance, if you have a higher level spinal cord injury above T6 and you suffer from autonomic dysreflexia, that increase in exercise can trigger an episode of AD. So you might know about that, but your trainer might not have ever heard of that. So you want to be sure and have somebody who has experience with individuals with spinal cord injury, develop a relationship with them, and really consult with your healthcare professional. Maybe you're a person who's been navigating in the community, doing just great for years and years. You decide you want to take on an exercise program, but this increased exercise might stimulate that orthostatic hypotension that you haven't had for years and years. So there are lots of things that can happen, so you want to really be sure to know your healthcare issues, what's going on, to get a person who can help you look for these kind of things. If you have a blood clot, or if you have some edema, or if you have a soft tissue injury, all of those kind of things. Also, if you decide to go to the gym, you want to be sure and take your equipment that you use normally. So if you have a special seating device that you sit on, any kind of pressure reduction cushion, if you transfer onto the equipment in the gym, there will be some foam padding there, but it won't be pressure reduction. So watch and monitor yourself while you're exercising, that you don't create a pressure spot where you've never had a pressure spot before. And I always like to remind people that maybe they've had some active wear shoes, activity wear clothes that they just normally wear, nothing's ever rubbed, but now all of a sudden you're doing some exercise, so you're moving in a different way, and all of a sudden your shoes give you a blister, or they create a red spot on your foot, or the waistband of your pants starts rubbing against you. So there's just all kinds of things to check to be sure, but as a person who knows how to care for themselves, you should be able to look for some of those things also. Here's another good question. Any tips for getting rid of the belly that folks with paralysis get? Well, Beth, oh my goodness, I hear about this all the time, and it's a very difficult situation, because part of the reason why you get that protruding belly is because of the muscles that are not getting the input in the abdomen. So therefore, there's no reason for them to resist. And so you kind of get this little pot belly there. And it bothers a lot of people. It bothers a tremendously large number of people. This is probably one of the things that people complain about the most, that and, the spread in the hips from sitting a bit, too long. So for the belly, probably about the only thing you can do for that is to get a small electronic stimulation device that will stimulate your abdominals to work. You can do sit-ups. Some people will do some sit-ups, but it depends on what the level of your spinal cord injury is, if your sit-ups or if your ab crunches are going to do anything in that lower abdomen. So generally, that's about all I know. And if anybody has any ideas for getting rid of that little bit of belly that people sometimes get with that spinal cord injury, it's due to the laxity of the muscles, so you need to strengthen the muscles. If you can't do that biomechanically by yourself through exercise, the only other way I know is to do some electrical stimulation locally on your abdomen. You don't want to just go out and do this on your own. There are some devices that I see on late night TV, which is like a little waistband that people put on. It has some FES right into it, which, then they advertise, just sit on your couch and tighten your abs, You might want to think twice about doing that. Anybody should think twice about doing those kind of things. But that's probably about the only way that I know of where that little belly is going to really strengthen up to tighten those muscles. So where can people go to find and participate in exercise research? Well, the best place to go is to start at your rehabilitation facility, because that's where you have physical therapists that are really knowledgeable about people with spinal cord injury, and they can help you get started. It doesn't mean you have to go there all the time to do the exercises, but they can certainly help you get started. Many people do some of the advanced therapies, the standing therapy. The physical therapist will show you how to get into the device, what to do, but people do that at home. So a lot of people do these exercises at home and then just go back periodically, like even maybe once a year, to see if they can upgrade their exercise program or move forward. Another place is to go to a wellness center if they have somebody who's able to work with people who have experience with individuals who have paralysis. A lot of times if you go to your wellness center and you have them contact the physical therapist, a lot of times you'll find a physical therapist who will be able to work with the people at the wellness center. So people are always kind of generous, I think, with their time in that regard. Okay, so now if you have, here we go. Antonio has a great question. What are the recommended steps when sustaining an injury like a shoulder sprain when living with paralysis? So the first thing you want to do is you want to take very good care of your shoulders, because a lot of people who have paralysis are using their arms to propel their chair. This is one of my favorite topics. There's a woman, an occupational therapist, who actually is an individual who also has a spinal cord injury, and she studied extensively strain injuries to the shoulder, oftentimes just because of overuse in propelling the wheelchair. Sometimes people who have spinal cord injury who are get to an older age, as we're all going to, sometimes that catches up with people and they need to have shoulder replacements. And so, of course, we don't want that to happen, because when you've had something happen to your shoulder or a knee or a hip and you get it replaced, it's wonderful when you really need it, but it never works quite as well as what you were born with. So, it's better to get one if you have damage to a joint, but on the other hand, it's better to save the joint in the first place. Now, when you're propelling the chair, you can really get pretty active in doing that, and a lot of people reach way back to grab onto that wheel to really give it a thorough push forward so they can move faster, because people are always in a hurry, right? Everybody is. So a lot of times people overextend their arms way too far in the back to propel. So one of the things to watch for is to just have your arm go straight down and propel, not reaching so far back, but just have your arm go straight down and then propel forward from there. Now, a lot of people don't like doing that because you don't get the momentum to really zip down the sidewalk or down the road. So sometimes people don't want to, reach that just straight down. They want to go back a little bit. Going back a little bit's okay, but save that for emergency purposes or when you really need to go someplace fast. So if you feel like your shoulder is at all hurt, it's aching, it's sore, and that aching and soreness is not going away, you want to check with your healthcare professional, because maybe you just need some rest and relaxation of that shoulder sprain. Maybe you need to ice it. Maybe you need to heat it. You need to find out, and icing and heating depends on when the injury occurred, which you do, and so you want to be very careful with treating that. Sometimes you can use some light pain medication like Tylenol, Aleve, Motrin, depending on what you have, but you don't want to take that for too awfully long because it can affect your kidneys. So the best is to just, look at your mechanics of your chair. Try not to pull back too far to propel that wheelchair, which kind of puts a little bit of abnormal twist on your shoulder. And then the other thing, too, is to also look at the mechanics of your chair. So sometimes people like what they call the dump of the chair, the seat. They like it to be at a real extreme angle because they can get a better pull on the back of their wheelchair, especially when they're doing wheelchair racing. So look at the dump of your everyday chair to make sure it's not too extreme. So oftentimes you can fix your shoulder by fixing your equipment and making sure that it's just perfectly in alignment for you. So always, if you feel like you're having some problem with a joint, you want to check with your healthcare professional. You want to make sure that it's not strained, or you want to make sure that the pain that you're feeling is not from a blood clot. Because sometimes when you have trauma to a limb, which can be just bumping it lightly up against something, you can get a blood clot form there. Sometimes people like to cross their legs in the wheelchair, which is crossing your legs for anyone is a risk factor for developing a blood clot, especially behind the knee. Sometimes people like to fling their arm over the back of the wheelchair because it kind of helps hold your upper body up, gives you rest, and it's kind of comfortable. So that kind of thing, though, can constrict those blood vessels in your arm when you have it, your inner arm, your upper inner arm, and that fleshy part under, underneath between your armpit and your elbow, and that fleshy part of your arm, or in the opposite side of your elbow. Sometimes you can get constriction in the vessels there, which can lead to blood clot. So I hope that answered your questions about that. Probably a little more information than you really wanted to know. Okay, let's see. There's some more questions coming up here. Okay, here's a question that a caregiver is worried about her brother with SCI who is not willing to exercise because it's not like he's going to walk again. What should she do to encourage him? Well, that is an attitude that is an unfortunate attitude to have. It's not an attitude that I have. Most people who deal with spinal cord injury or any kind of paralysis have a very bright hope for the future. Now, that's a lot different than when you're living with paralysis. Okay, so when you're living with paralysis, each day is very, very long. until something else comes up. And when we who work in spinal cord injury get all excited about something that's a breakthrough that's come through that we're really excited about, and then it doesn't translate into an immediate cure, people get very disheartened about that, especially people who have been living a long time with spinal cord injury, who've been on this roller coaster. Oh, look, we've got this. It's so close. Oh, we've got, it's just around the corner. Same thing with people who have cancer. There's been since the 60s, there was a big, you remember when we had the war on cancer, and one of the presidents declared this war on cancer because there were discoveries made that people felt like, yes, it's just right around the corner. And here it is. Now we're in the teens, in the 20 teens from the 1960s, and we still don't have cures for cancers. We've made a lot of strides in cancer treatment, but there's no definitive cure for all cancers. Many cancers are curable, and there's still some that are not any better than they were in the 60s. So same thing with spinal cord injury. There's been a lot of strides, but when you're a person who's waiting, it takes a long time. So why do we need to exercise? Well, we need to keep our bodies healthy just for general health. Everybody does, paralysis or no paralysis. But also when we think about all the things that are going on in the treatments and the strides that are being made just in the last 10 years, if you go back to the last 20 years, it's a night and day difference in how things are. 20 years is still a long time. 10 years is still a long time. So what do you do to encourage them? Well, the best thing is probably if he has that attitude about walking, then it's probably going to come true. But as a person who has a spinal cord injury, you want to keep your body healthy. You want to provide input to those nerves and muscles below the level of the spinal cord injury, because there's a lot to healing that takes place besides the research and treatments that are available now. We also know that providing input to those nerves and muscles, then those nerves and muscles are sending messages up to the brain. You have the brain thinking about movement, sending messages down. So hopefully it gets to that place where the spinal cord injury is, and those messages going down from the brain and the messages coming up from the body are butting up against that injury, and they're trying to break through. What we find with people who exercise is they'll have more connections. Now, we all laughed and learned and made fun in college about drinking, and if you drink, you're going to kill off some blood cells and they're never going to come back, or kill off some nerve cells. This is just not true. We also know today, and this is just in the last few years, that we know that your skin is constantly turning over, but did you know that your nervous system is constantly turning over too? So it's a much slower rate, but nerve tissue is constantly being developed in your body. So if you can provide any kind of stimulation you can, that's going to help sprout those nerves and make those connections. The other thing is that exercise makes people feel better. It helps their body. It makes you feel better because it makes your body better. It makes your body healthier. And the other thing is that it prevents complications. So exercise can build up muscle tissue, which has a lot more resistance to breakdown than does fat collection or letting your muscles waste away. So there's a lot of good reasons to provide exercise. It makes me think of a story in working with Christopher Reeve. When I first met him, he had a terrible pressure ulcer on his foot at his ankle, and it had been there a long time, and it was just not healing, and it was just a bad, very deep ulcer. It oozed a lot, and so it was hard for him because, having this public persona, it was really difficult to go out and to contain the ooze, and the drainage from this wound was really difficult for him. And so he had talked to a physician about, now remember this is years ago, but he had talked to a physician about this ulcer that wasn't healing, and the sore was kind of festering, so it was taking the nutrition out of his body. It's kind of draining out of the sore. So he talked to a physician about what he could do about it, and the physician said, well, let's just cut off your leg because you don't need it anyway. It's just more weight to move around. I mean, this honestly is what happened. And so, I think I'd like to keep my leg. And fortunately, he decided that he would. And after he got exercising, the pressure ulcer healed, and so he did not lose his leg. And so it's kind of a very dramatic story that really points up to the fact that you can easily do a lot of things, a lot of good for your body just by exercising. So if you don't get to the point, if you exercise and you don't get to the point of having pressure sores and getting unhealthy, then it doesn't take long to get your body ready to be restored for any kind of improvement. And just by exercising, which was the treatment that Christopher Reeve had, he had made tremendous gains in his medical condition, in his paralysis, just through exercising. So he didn't have any of these surgeries. He didn't have any of these transplants. Now later he got a phrenic stimulator, which was an implant. But just for his recovery, what he did was exercise. He did the functional electrical stimulation, which I know some people get frustrated because they don't have a payer that will supply that, and we're all working very diligently to get that changed. But he did the functional electrical stimulation, which was the FES spiking. He did aquatic therapy. He did standing therapy. And he did partial weight supported walking. He did those 4 exercises. Now, it would be very difficult for somebody in the community to be able to get all of those therapies, but there are programs out there that do provide those. Now, you have to go to that program. You have to get the funding. It is possible. I've had people come to our program, and they've done all kinds of things to get their funding. So you never know how that source. So just so you think, well, my payer won't pay for that. I can't do it. There might be other ways. So don't ever give up hope in that direction either. But anyway, by the time he had, but when he was doing that, when we were monitoring him, he had made very little gains. But now this is a man who really, his function was, he was a high-level quadriplegic, ventilatory dependent. Okay, so here was a man who he made a little tiny bit of improvement in pinprick sensation. So when they do your Asia testing and they do the pinprick, he had made some gains in that. But he had made huge gains in his ability to feel more broader kinds of sensations. So, when they do the cotton swab test on you to see where your sensation is, he was up to like 70 points out of 100. So he could feel things more broadly, not the isolation of a pinprick, but general broad feelings. So he could feel things like when his family hugged him. He could feel things like if he had a wrinkle underneath his skin, if his clothes were wrinkled underneath his body. So he could feel a lot of things in a general sort of way. I could say something is wrong underneath my leg, but maybe not be able to pinpoint exactly where under his leg. But still, it would give you a clue where that issue was occurring. The biggest recovery part that he had was in his movement. And in his movement, he was able to move all the joints. He was able to move every part of his body, but not against gravity. Okay, so he could move his arm from side to side, but not up and down because gravity was there. But now let's think about this for a while. Okay, so this was just with exercise. That's all. just exercise, he was able to make that much of an improvement. And this was years later that he started this after his exercise. He started this after his accident. It was not immediately after. It was many years after his accident that he started. So you have to kind of wonder, if he had some of these other treatments that are going on now, what kind of improvements would he have met? So we're really talking about quite dramatic differences from people who exercise and people who don't exercise. So there's no doubt in my mind, there's evidence, scientific evidence that demonstrates that exercise can help you regain function. So it's very important. Now, the thing of it is that if you eliminated the gravity, Christopher Reeve could actually walk. So how did he do that? Well, some of the things were he could walk in a swimming pool. Now, one of the problems with spinal cord injury is that balance is hard. You have to be able to support and hold up your body. But if he was supported in the swimming pool where the water can act as a little bit of a buoyancy, so he could pick up his foot and his leg and actually take steps and walk across a swimming pool, being in the water. In the partial weight supported walker, he could walk for great lengths of time on his own accord. Once the therapist got his legs stimulated and got him going, he could continue and do that reflexive sort of walking on a treadmill. And he could go and go and go until, eventually your foot moves a little this way or that way and you kind of get tripped. But he could go just and walk for 45 minutes if he didn't get tripped up. He could just do that. So what scientists were thinking about is that there's probably a pattern generator in the spine. It's something that you can't see. It's not something you can look at and say, oh, there it is. But there's probably some kind of reflexive response in the spinal cord that will cause your legs to walk once they get into that pattern movement. If we look back historically, polio is a disease where people lost movement, but through a medical problem as opposed to a trauma. But polio is a disease where people lost movement, and what ended up to be the treatment for polio, which did cure people with their polio, was exercise. So the same kinds of things. So exercise is very important. So I will step off my soapbox now, and we'll move on to the next question. So carpal tunnel issues. So carpal tunnel issues, what about them? Well, the nerves have two basic systems. There's the central nerves that are in your brain and spinal cord, and then there are peripheral nerves, and those are all the nerves that come out of the spinal cord, and they go all through your body. So carpal tunnel is in the wrist. There is a little tunnel where the median and ulnar nerve travel right through the wrist, and it's through this little tunnel. And the little tunnel is made up of tendon-like tissue. Sometimes I've heard surgeons who operate on carpal tunnel, they call it gristle. And I always think, ooh, gristle. But basically, that's kind of what it is. And so sometimes that tendon gets swollen, and it's oftentimes from overuse or from swelling. So people who get carpal tunnel issue are people who repetitively use their joints over and over and over and over again. So in range of motion, we're not talking about that much repetitive movement, but people who do the same motion over and over and over, like twisting a screwdriver all day long, that kind of movement. I had a lady once who had carpal tunnel because she was a cake decorator, and they had those bags of frosting, and they bring them out of the refrigerator, so they're kind of hard to squeeze, so that she put a lot of pressure on her hands and her wrists to decorate cakes, and she decorated cakes all day long, and lo and behold, she developed carpal tunnel. Other people who develop carpal tunnel are people who have swelling in their joints. So sometimes if you sleep on your arm funny, and you wake up and your hand feels asleep and you shake it and you wake it up, that is probably from having that pressure on your arm has probably put some swelling in that joint where that nerve travels through there. So people who have swelling normally in there are sometimes people who have weight issues. People who become pregnant have a higher incidence of carpal tunnel. That does not mean that everybody who becomes pregnant will have carpal tunnel, but because of the extra fluid that people carry with pregnancy, they tend to have a higher incidence of carpal tunnel. I am sure that the carpal tunnel that you're most interested in is when you push that wheelchair with your wrist and you're flipping that wrist around. However, if you're finding that you're having wrist problems, you can get some adapters so that you don't have to hold so tightly on the rim of your chair, or you don't have to move your wrist in that direction. You should not really have to move your wrist at all. It should be moving your forearm and from your elbow and your upper arm. So your wrist should remain rather stagnant. However, sometimes people do when they move their chair, they tend to extend their wrist. So if you look at your arm, your hand should come directly straight from your arm. That's the neutral position. Okay. If you bend your fingers down, then you'll see that your hand is kind of making a little umbrella there. And so you can see that the skin at your wrist is doubling up. You see wrinkles there at your wrist. So the skin is very loose. So one of the rules we have in healthcare is what you see on the outside is going on the inside. So if you bend your wrist down, you can see the skin is you can even kind of pick at your skin and, kind of pull up a little bit of it because it's very loose. When your arm is straight and neutral, you'll see the skin just fits perfectly over that spot. Now, if you bend your wrist back, so if you bend the back of your hand towards the back of your arm, you'll see the skin now becomes very tight over the wrist. Okay, so when that skin becomes tight like that, that is when you're pulling that tunnel and those nerves inside there. And you'll see that you can't pick at your skin and pull up even a little chunk of it because it's pulled taut, very tight over your wrist. So you want to keep your hand in that neutral position. If you need to wear some gloves when you wheel your chair so that you don't have that pulling on your wrist. Sometimes people develop a tendinosis where they stretch their wrists like that so that they have better movement when they have injuries at certain levels. So if you need to wear something to keep your wrists straight, you might want to do that. But that's how you can pretty much tell if you're putting too much pull on your nerves. So if you push your hand back, you'll see that that skin is really tight. Then that nerve is tight in there too. If you put your hand at neutral, straight, it's extending straight out from your arm, you'll see that the skin fits just right. You can push your finger on it and it move around because there's a little bit of give to it. It's not too tight, not too loose. And if you pull your palm towards your arm, you'll see that the skin is very loose. So it's very loose there. So that's something that you want to watch. If you do tend to have carpal tunnel issues, then you might want to have it corrected. Most people can correct their carpal tunnel issues by wearing a brace. You want to be sure that when you get your brace that it keeps your arm straight from your arm straight out to your wrist. Braces come in an extended position. There's a piece of steel, a piece of metal in them, which will extend. So if you just go into the drugstore and you buy a wrist brace, it's going to extend your hand so that you have that wrist stretched backwards because that's what is considered the most functional. If something should happen to your hand, that's the best functional position for it to be in. But if you get a brace, and it might take a month, 6 weeks, 2 months for that numbness and tingling to go away in your fingers from the carpal tunnel, then you can wear that brace, but keep your hand neutral. So keep your hand directly even with your arm, so that it's not extending back because that's pulling on it. So if you feel like if you feel your fingers are numb, it could be because you're having a carpal tunnel issue. If it's your thumb and your first two fingers, it's the median nerve that's being affected. If it's the ring and the pinky finger, then it's the ulnar nerve that's being affected. Sometimes people will have numbness and tingling in their hands and think, oh, I have carpal tunnel. I need to go have that released, but you can try with a brace, try conservative treatment with a brace that's flattened so that your arm is flat, your hand and your wrist are flat. You can try, but it takes a long time, and people think, well, gosh, I've had this on for a couple of weeks and nothing's happening. No, it's going to take, maybe even a couple of months. Now, sometimes you can get numbness and tingling in your fingers, and the problem is from what we call cubital tunnel, and that is up in the elbow, and there's a tunnel up there also where those nerves can get trapped in at the elbow. That's a more significant surgery. It's to have that corrected. So if you feel like that is going on, if you're having spasms, sometimes the spasms can give you that numbness and tingling. Try taking a towel and just wrapping it and then taping it around your elbow so that your arm is out straight when you're sleeping at night, but not hyperextended, but just straight, so that you can't fold it up and stretch that nerve inside the elbow, and that will help that. There's also an entrapment point up in the just above the shoulder, up closer in that brachial plexus where all the nerves come out of your neck to go into your arm. And then there's also some entrapment points down in the legs that you need to worry about too. So people know about carpal tunnel, but they don't know about all those other entrapment points. So that's all I know about carpal tunnel, and again, probably more than you wanted to hear, but that was the question. What about carpal tunnel? Well, that's what about them. So that should give you everything you need to know about that. So now, what if you have some random spasms of pain in the hip flexors near the top of the leg and the bottom of the torso rotating out? What is the term for that? Well, I'm not exactly sure what the question is, because random spasms are exactly random spasms. And they can come in the hips. Spasms can come anywhere. So near the top of the leg, and then rotating out. Well, actually, when you lay down and your body's just in normal position, what you want to happen is that you want your toes to be pointing straight up to the ceiling. But your body tends not to do that. What your body wants to do is it wants to rotate your leg out so that your toes are really pointed more off to the side. Then you get this external rotation in your hip. And so I'm wondering if you're having spasms just in that hip, if at night you're not positioning such that your feet are pointing with your toes straight up to the ceiling. That's the way your body should be laying, but it's not the way your body wants to lay. So when your body when you don't have the musculature to point those toes straight up to the ceiling, your body will just automatically rotate off to the side. So putting a pillow up along the outer side of your thigh, not underneath your leg, but just on the outer side, or wearing those moon boots or space boots, and we go through different phases and call them different things, to prevent pressure sores on the back of your ankles, or on the back of your heels and on your ankles. If you wear those will hold your legs up into position, and that will probably stop that spasming. It's probably coming from when you're laying down in bed, either at night or when you're taking a rest. Now, when you lay on your side, your toes will be pointed to the side because that's the direction that your nose is pointed. So you always want your toes pointed like your nose. And so when you're laying on your back, they should be pointed straight up. When you're sitting in your chair, and you're sitting in a chair, you will find that your your hips don't rotate out as much, but they can if you have weak hip muscles. And so that's probably what the problem is there. So probably a positioning thing will help that, and that will reduce that spasming that's going on there. And then, Rod, I hope I answered your question about carpal tunnel due to wheelchair push usage, pushing that wheelchair. If you try to just put your arm straight down and then pull it forward, but not moving your, not using the wrist as your propeller, but using your whole arm as the propeller, then I think you'll find that a lot of your trouble with your carpal tunnel issues will go away. So it's a matter of positioning your arm and getting, keeping your body in alignment. If it's with your hips or if it's with your arms, keeping your body in alignment. But then also what's going to give your body a lot of relief is to do that just very gentle range of motion, even a couple of 3 or 4 times a day. I know that's asking an awful lot. But just that very gentle ranging. You don't want to cause, you don't want to overstretch anything. You don't want to be aggressive with your body and, drop your limb or fling your limbs about, because you can give yourself damage without even thinking about it. So I hope that's answered everybody's questions for today. And I see we're at the top of the hour. So I guess it's time to cut off for the day. But if you have any questions or anything else pops up, or maybe I didn't answer your question thoroughly enough and you want more information, I am available on the blog if you want to write in, and I can give maybe a more concise answer or more detail, whichever you need and prefer. So without further ado, I thank everybody for coming today. Oh, they got disconnected. Okay, so it says, Linda, just go ahead and say goodbye. So, all right. Thank you, everybody, for coming. And I had a wonderful time today. I hope that you did too. And we'll talk to you again next month, or be sure and write into the blog. I'm available really just about any time. I try to answer as quickly as I can when your questions come in, but I am available on Wednesday evenings, so be sure and call in. Thank you so much. Bye-bye.